Understanding the realities of anal penetration. Risks, precautions, and myths debunked in today's world. Conversations around sexual practices are becoming more open and honest, and one topic that often comes up is anal penetration. According to recent studies, 33% of women and 37% of men have engaged in this practice at least once in their lives, and about 10–15% report doing so regularly. But with this practice comes a series of questions and concerns. Is it safe? What are the risks? What precautions should one take? And perhaps most importantly, is it true that anal penetration can lead to fecal incontinence? These are the questions we'll be addressing in this article. 1. What is anal penetration? Anal penetration refers to the insertion of a finger, sex toy, or penis into the anus. It's a practice that some find pleasurable, while others might be curious about it but have concerns regarding its safety and risks. 2. Why do people engage in anal penetration? For many, anal penetration is a form of sexual exploration. It offers a different type of stimulation compared to vaginal intercourse, and for some, it can be a way to enhance intimacy and trust in a relationship. 3. The emotional and psychological factors. Sexual practices, including anal penetration, are often influenced by a variety of emotional and psychological factors. Curiosity, trust, and a desire for pleasure are common reasons people explore this practice. It's essential to communicate openly with your partner to ensure that both parties are comfortable and willing. 4. The physical risks. What you need to know. One of the most significant concerns regarding anal penetration is the potential physical risks involved. The anus is not as naturally lubricated as the vagina, which means there is a higher risk of tearing or injury if adequate lubrication and care are not used. Additionally, there's the risk of transmitting sexually transmitted infections, STIs, if protection is not employed. 5. Can anal penetration cause fecal incontinence? This is a common myth that needs to be addressed. Fecal incontinence, or the inability to control bowel movements, can be a concern for some, but it's not as common as people think. The risk of developing fecal incontinence due to anal penetration is relatively low, especially if the practice is done with care. However, repeated and forceful penetration without adequate preparation and lubrication could potentially weaken the muscles around the anus, leading to problems. 6. Precautions to take. How to minimize risks. Taking the right precautions is crucial to minimizing the risks associated with anal penetration. These include using ample lubrication. As the anus does not self-lubricate, using a generous amount of lubricant can prevent tears and discomfort. Starting slow. Especially for beginners, it's essential to take things slow and allow the body to adjust. Communicating with your partner. Ensure that both partners are on the same page and comfortable with proceeding. Using protection. Condoms can help prevent the transmission of STIs and protect against bacterial infections. 7. Psychological readiness. Preparing yourself mentally. Mental and emotional preparation is just as important as physical readiness. Understanding your boundaries, discussing them with your partner, and ensuring mutual respect and consent are key to a positive experience. 8. The role of hygiene. Why it matters. Good hygiene practices before and after anal penetration are critical. Cleaning the area thoroughly can reduce the risk of infections and make the experience more comfortable for both partners. 9. Myths about anal penetration. Debunking common misconceptions. There are many myths surrounding anal penetration that can cause unnecessary fear or anxiety. For example, the belief that it will always cause pain or that it's only for certain types of people is simply not true. Like any sexual practice, it varies from person to person, and with the right approach, it can be a safe and pleasurable experience. 10. Understanding the anatomy. What happens during anal penetration? Knowing the anatomy involved can help demystify the process. The anus and rectum have a complex network of muscles and nerves, which, when stimulated correctly, can lead to pleasure. Understanding this can help alleviate some of the fears associated with anal penetration. 11. The importance of aftercare. Aftercare is an often overlooked but crucial part of any sexual activity, including anal penetration. This involves checking in with your partner emotionally, discussing the experience, and addressing any discomfort or concerns that may have arisen. 12. Seeking professional advice. When to consult a doctor if you experience any discomfort, pain, or other symptoms after anal penetration, it's essential to consult a healthcare professional. They can provide guidance and ensure that no serious damage has occurred. 13. The cultural and social stigma. Breaking the silence, anal penetration has long been surrounded by cultural and social stigma, making it a taboo topic for many. Breaking this silence and engaging in open, honest discussions can help normalize the conversation and reduce the shame or embarrassment some people may feel. 14. Sexual freedom. Embracing your choices. At the end of the day, sexual practices like anal penetration are personal choices. Embracing your preferences and understanding the risks and precautions can lead to a healthier and more satisfying sexual life. 15. Conclusion. Is it right for you? Deciding whether or not to engage in anal penetration is a personal decision that should be made with full knowledge of the risks, precautions, and potential outcomes. By taking the necessary steps to prepare physically and emotionally, you can make an informed choice that's right for you and your partner. 1. Is anal penetration safe? Yes, it can be safe if done with the proper precautions, such as using lubrication, going slowly, and communicating with your partner. 2. Can anal penetration cause permanent damage? Permanent damage is rare, but repeated and forceful penetration without proper preparation can lead to issues such as muscle weakening. 3. Do you need to use protection during anal penetration? Yes, using condoms is recommended to prevent the transmission of STIs and other infections. 4. Is it normal to feel discomfort during anal penetration? Some discomfort can be normal, especially for beginners. However, severe pain should not be ignored and may require stopping and reassessing your approach. 5. How can I make anal penetration more comfortable? Using plenty of lubricant, starting slowly, and ensuring good communication with your partner can help make the experience more comfortable. Thank you for taking the time to learn with us about wisdom of health. We hope this information will help you approach this topic with confidence and responsibility. Don't forget to subscribe to our channel to stay informed about other health and wellness topics. Take care, and see you soon.